for a person who is delivering for the first time, the time taken can be long compared to a woman who has already had one or two or three children. So what is a birth plan is basically you've chosen your doctor, you've chosen a place to deliver. Similarly, how would you like to experience the process of labor? And in that, it's about positions. There are different positions that you can have during the whole process. There is obviously pain which is experienced. So what kind of pain relief you want?
Hello and namaste. This is Sonia Fawa once again, your friend and guide from Nine and Beyond, your holistic pregnancy app to help you with your smooth pregnancy, planning, delivering, and like we promised, all the possible guidelines for you forever. Today, again, we have with us our very esteemed doctor, Dr. Deepali Prabhat, who by now does not need any introduction. But for the ones who are probably the first timers on the podcast, she is a very famous gynecologist and an obstetrician from Mumbai, having almost 35 years of experience behind her, running her own nursing home, being attached to very famous hospitals, achieving a lot on her way. And let me tell you one thing, knowing her personally now over the time, she is not just a doctor. She is actually, find that she done a diploma in lifestyle medicines from the prestigious USA College of Medicines of Lifestyle Medicine. It actually makes her the master of life sciences. So she goes beyond her medical thing and guides you on things which basically make your journey of pregnancy as wholesome, as enjoyable, and as smooth and healthy as possible. A warm welcome to you, Dr. Dipali. Thank you, Sonia. It's a pleasure having you again with us and for our audience who are blessed to have your knowledge shared with them. So in today's podcast, the whole idea is to cover up an overview of birthing process. We have talked enough about the journey, but I think it's very important today's time of technology, precision, science development, when the lucky new generation has everything laid for them on a platter, doctor, right? That when, with so much precision, if they also have a knowledge and they're empowered with the knowledge of the birthing process, I'm sure this knowledge and wisdom will help them in a very smooth delivery and labor, which I think is one part of pregnancy people kind of fear. Right? Absolutely.
So it's a part of the journey of pregnancy where we know it's very good if we are empowered with what to expect.
Absolutely.
Just like if you appear for any exam, you're not going to go unprepared, right? You're going to study the subject well.
Yeah.
So I think what are the most important things that we need to know is we have to have all the correct information and then learn how to adapt that information to your own situation.
Right.
And use all the tools that you have.
Absolutely.
To do the same.
Yes. So, because the knowledge is definitely going to impact the birthing process, right?
Absolutely. And that is how your fears will get eliminated, because
The biggest thing.
otherwise you are just, thinking of something which is not realistic
Absolutely.
and getting into that spiral of anxiety and fear.
True. Absolutely.
It doesn't have to be that way. I mean, now we have, so much access to this information.
Absolutely. Right.
You have.
Yes. Today we have the best thing is there are tools to practice, choices to make.
Absolutely.
Right? For the preparation of the big day. Absolutely. So, doctor, what would be the key factors they should focus on while preparing for the big day?
Yeah. So one is you have to understand the process itself. So labor, the process of birthing, what are the stages of labor? And, you have to collaborate with your doctor or use other resources that you have to understand what exactly it entails. And then once you know that, you have to use that knowledge and see how it will fit into your situation.
True.
And there are so many tools that you can use to take care of, so that it's a smooth and a very enriching experience for
Absolutely.
the woman. And of course, a support system is very, very important. So even though it's the woman who is birthing, it's very important to have that physical and emotional support both during that process. And I think, so much of family, friends, your healthcare providers can help the woman have a very nice, positive experience.
Absolutely.
of
Like they
birth.
say, the baby carries the generation forward. So I think it's a duty of everybody.
Yeah, it is society's duty that
Cool.
you
Yeah.
make it like the best thing that the woman would experience. And I mean, it's, of course, the woman is the primary person who has to do it, but having a good support system is very, very important.
Absolutely.
So these are the basic aspects that any person who is going to go through the learning process has to think about in advance.
Absolutely.
Yeah.
Yes, to give her the courage, to give her the emotional and the physical support to make it as beautiful as possible for her. Absolutely. So starting with the process, like I think the most important part would be the positions, the birthday position.
Yeah,
I
so-
keep hearing these days is like,
Yeah. So first is you have to kind of understand the process of labor. Okay. Okay. For a person who is delivering for the first time, the time taken can be long compared to a woman who has already had one or two or three children. So generally, it's like, if you've done it once, it's easier the next time, most of the times. So once you know how much time it is taken, and then you kind of have to apply that knowledge and decide what is your choice. So we typically would call that a birth plan. Okay, so what is a birth plan is basically you've thought about these things and then you've chosen what is it that you want. Like you've chosen your doctor, you've chosen a place to deliver. Similarly, how would you like to experience the process of labor? And in that, it's about positions. Okay, there are different positions that you can uh, have during the whole process. And there is obviously pain which is experienced. So, what kind of pain relief you want?
right.
Okay, which also, I mean, there are so many techniques. It doesn't always have to be a medicine for pain relief. There are other tools that you can use for that. That you can choose for the way you want to deliver. Like, I mean, it's not that every time it's possible to have a vaginal birth. You would want to have it, but sometimes even if it doesn't happen that way, so you have to get aware of all the aspects which will be the best for your situation.
You mean to
So
say,
that-
for example, you can choose between whether you want a normal delivery or you want to have a cesarean.
That kind of choice is now some certain women are taking that choice. I'm not endorsing it.
Okay.
Of
It's not a
course.
healthier way of choosing.
Yeah,
Let's
because
put it
there
like
are
that.
certain advantages of having a natural vaginal birth. But
Absolutely.
in certain circumstances, it may not be safe. So, suppose for whatever reason a woman has had a cesarean for the first time,
Right.
for the next child, definitely the chances of having a cesarean again are more. And if there are certain other considerations also from point of view of the baby, you may choose to have an elective cesarean the next time. So I'm talking in terms of choosing in that manner.
Okay.
That where you would choose, okay, I would want to have an elective cesarean, and so that becomes a part of a birth plan.
Okay. Yeah. So this is for the second time, basically. But
Yeah.
basically, when you are talking about the birth plan,
Yeah.
what I'm trying to understand is that this is basically for the vaginal delivery. You are saying
It's for
these
the
are the
delivery.
choices
It's
which you
for
can
a
make.
delivery. You have to.
All right.
So birth plan always has to be flexible. We know that whenever a woman delivers, there are about 80 to 85% chances of having a vaginal birth, which is subject to a lot of things. It so much depends on the age of the woman at the time she's giving birth. It depends on the flexibility of her body. It depends on how much of a risk is involved in for the baby to go through that process of labor. So there are multiple considerations to be taken into account.
Okay.
So in that manner, whatever has she's gone through in the antenatal period, you can plan for
Got it.
either hopefully for a vaginal birth, but also have that there is a possibility that even if you have to go for you need to have a cesarean, that also you should have thought about it. Okay.
And this is a last minute emergency, right?
Exactly.
which is
Yes. Yeah. So even if it's a last minute emergency, if you've thought about it, okay.
yeah.
So if then you are not like, why is this happening? You don't feel like a failure or anything of that sort.
Got it.
Because many times labor is such an unpredictable process. Basically, it involves the woman where it's the passage, okay, the birth canal through which the baby is going to pass through.
True.
It is about the passenger, which is the baby. Okay, so that fit has to be there. And it's about power, which is the uterine contractions, which are going to push the baby out through the birth canal. So, all these three things, if they're extremely favorable, which they are in many cases, then the vaginal delivery is going to be smooth and fine. But if there is any mismatch in either of them, then we have the alternate route of delivery, which is a cesarean. And finally, end of the day, we want to have an outcome which is best for the mother and for the child.
डॉक्टर ऑनेस्टली आई मस्ट से दैट ये आप ही ने टॉपिक सजेस्ट करा था एंड नाउ मुझे सडनली रियलाइज हो रहा है कि ऑनेस्टली कहीं पे भी कोई भी जना इतना पेन लेके ना लोगों को तैयार नहीं करता है इस दिन के लिए, राइट? सो आई एम वेरी हैप्पी कि आज हम लोग ये चीज़ के बारे में बात कर रहे हैं एंड वी आर एम्पावरिंग देम विद दिस नॉलेज ऑनेस्टली बिकॉज लाइक in our time nobody said anything.
Yeah,
They came and it happened, right?
That is what
All the fears and anxieties, it happened.
Yeah,
So I'm so happy
Yeah.
कि आज
And
आपने
of course,
Yeah.
in Western countries, and maybe I'm sure it must be happening in some of the hospitals, even in India, where they have a written birth plan, where you actually jot down every choice and all that. But even if that doesn't happen, it has to be kind of thought of, where at least you have to have that idea that yes, I need to think about these things. I need to talk to my doctor about these things. Need to find out knowledge. The information about these things, and then go in with a flexible, open mind. But if I want these things, then I have to also work towards it. So when we talk about working towards this, is when we talk about the tools that we have to work towards this process
and the choices we can make.
Yes.
That's good. So when you talk about the tools, how would you explain that better?
Yeah. So when we are preparing for a vaginal birth, the passage, okay, it consists of course, the bony passage, which is the pelvis, and the soft tissues.
Okay.
And the soft tissues, a very big part is the pelvic musculature,
Okay.
which has to be very supple and flexible. Okay, wherein all your antenatal preparation comes in. So women who are very physically active, who do prenatal yoga or do the Kegels exercises, which we spoke about, the pelvic exercises. Okay, so their birth passage definitely is going to be much better equipped to, allow that process of labor to go through smoothly and in time. Because we as with the evidence-based medicine that we practice, we know, okay, this is the time that we can allow the first time birthing woman to, there are different phases of labor, so this much time we can allow, because beyond that we've seen that there are more complications for the mother and the child. Okay, so if you want to be in that limits, then all these factors are going to help you, okay, in to be, in the progression of labor. So one is all the exercises, then having the knowledge about different positions, which I mentioned, which will improve that outlet. Like suppose if I'm to talk about positions now, which the woman can assume during labor, there is an option of being standing upright positions where gravity is going to aid the child really. So any kind of upright position. So that's why we want the women to be mobile. They can be sitting, not lying down all the time in bed.
So when the labor pain starts, you be labor. Yeah, during exercise.
So basically, if I want to tell you about the stages of labor, from the time the labor pains start, which are effective labor pains, from the time till the full dilatation of the cervix, which is the mouth of the uterus, that is the first stage of labor. Okay. The second stage is from the full dilatation of cervix till delivery of the baby. Okay. The third stage is the delivery of the afterbirth or the placenta. Okay. So during the first stage is also divided into latent and active phases. So the active phase is when this entire dilatation is happening much more rapidly, and in a particular, we want it to happen in a particular speed. So that's where the difference comes for the women who are delivering for the first time, and for multi-gravidas, second or third time.
Okay.
So that time period will shorten as you have more.
All right.
So if during that, so the uterus is trying to push the baby out, okay, the baby is making different positional changes and wriggling out through the passage. So gravity can help if the woman is upright. Okay, so that is, it kind of opens up increases the dimensions of the pelvis. So any kind of upright, standing, sitting, squatting position. So all these positions should be practiced in the antenatal period, which the woman should be, knowledgeable about, and she should she should know what is comfortable to her beforehand, before she goes into the labor. Then, of course, you have lying down, semi-sitting, lying on the side. There is a position which is when you're on your hands and knees, like all fours.
Yeah.
That is good for babies who are turned towards the back. And, sometimes back labor, posterior positions can be more painful.
Right.
So these are positions which can be adopted at different times of labor, not necessarily while actually giving birth.
Right.
So all these will help in alleviating the pain. So this is one of the way you can take care of it. Then, of course, the other tool is your breathing exercises.
Okay.
So that also,
Doctor, before we go to breathing exercise,
yeah.
तो prenatal classes में ये सब सिखाते हैं?
हाँ, बिल्कुल. So all these are taught in the antenatal classes.
Okay.
They make them practice it.
Okay.
And they can use that. So that's the learning basically from that.
Yeah. Right. Yeah. Okay. You're talking about the breathing techniques now.
Yeah.
Yeah.
So the breathing, when you do it in the antenatal period as a part of pranayama, basically you're improving your lung capacity and you're increasing the oxygenation of your body and indirectly the oxygenation to the baby. Once you've practiced those, then what you use during the childbirth are little bit modifications of the same.
Okay.
So there are different schools of, like there's Lamaze breathing. There is certain kind of, like I did one course in hypnobirthing where they advocated something like a balloon breathing during contractions and a normal surge breathing. So all these are different. Whatever helps you, you can use that. There are visualization techniques where, you are visualizing a very calm, smooth past experience, and that will help you.
Okay.
So you can use all these tools to alleviate the pain that the labor can, the woman can take care of. And of course, we have epidural anesthesia where, the typical painless labors where we are dulling down the sensory sensation with the use of a pharmaceutical product.
Okay.
So all these options, if you know these are there, and then you can choose from. So you should know whatever, is available to you, and then you have the choice of using it.
So epidural जो बोल रहे हैं आप, this is a choice you have to make, or is it done for everybody these days?
It's not done for everybody. So if it's not that everybody will need it, right? So actually birthing is not supposed to be very painful. Okay, it will be discomfort, but the pain comes from the fear and anxiety and the tensing of all your body muscles, and then you make some chemicals. It's like,
right, got it.
So it is so many things combined. So whatever your antenatal preparation will, of course, reflect on how the labor will go.
I think अभी आपने एक बड़ा important point बोला जो honestly एक general image है that the labor pains are supposed to be the ultimate pains, right? और आप बोल रहे हो they are not supposed to be that pain.
Not supposed
to
be.
It is our anxiety and our own fears which actually make it painful,
and
right?
To some extent, unpreparedness also.
Exactly.
So we expect that everything will go smoothly, but we haven't prepared for it that much. So if you've prepared for it antenatally in terms of physical fitness, in terms of, overall your mental health and everything, then you go in it with like, you're looking towards it as a positive experience rather than something that you're fearful about. And you go with an open mind where you're accepting of certain unpredictable events that may arise during the process, and you accept that as well, because you have to understand that whatever is being done is done for the benefit of the mother or the baby, both. So,
I think for you audience आज एक बहुत बड़ा it's a big eye opener, because मुझे खुद के लिए एक इतना बड़ा eye opener लग रहा है कि it is not supposed to be that painful. It is our own anxieties and fears जिसकी वजह से हम इस process को complicate कर देते हैं. But अगर if we are like knowledgeable, using our wisdom, exercising right, preparing ourselves right emotionally and physically, right? Then probably it is a very
because I had one patient, even I was surprised, like she was a meditator and yoga practitioner, and she had such a beautiful first time birth of 5 hours, which is the shortest I've seen.
Wow. Yeah.
And it's not that like, it was, but I realized it was the power of her mind and her physical body that has happened for so many years. I'm not saying everybody can do that. I'm not saying that, but you can do as much as you can with the help of these tools like our app. These kind of things where you're having access to the resources. You can use them and you can do as much as you can, and you will definitely have a much better experience.
Absolutely. Like I think, when you have the knowledge and empowered with that knowledge, definitely that's a tool. Absolutely right. Perfect. So knowing that now we have birthing techniques, the positions, which can make it very, very smooth after. What else besides this should go into the planning to make this a very smooth journey?
So as I said, a good support system. Okay. So, you should also choose whom you want to be at the time with you during your birthing process. You may want your spouse to be there. You may want your mother, sister, friend, whoever.
Okay.
So to give, there are of course the professionals also called as doulas, who are available, who help during support.
I of course know we have done a podcast with a doula. I think for people who are not still very aware, because जब मैंने ये podcast करता मुझे खुद नहीं पता था कि आजकल doulas होते हैं, right? So what exactly are doulas? Please समझा दीजिए.
Doulas are people who are like, somebody who's giving you support physically, emotionally throughout your, maybe a part of antenatal period also, because you have to familiarize yourself with right person. But they are giving you that support, and because as much as I say that it can be painless, it's not. Of course. There is, because there are uterine contractions. There is expansion of the vagina. You can imagine it has to expand to allow the entire baby to go through. So there will be discomforts. But if you have a person who is looking after you all the time, taking care of what is it that you need physically, in terms of you want this, you want to eat this, you want to drink this, they also guide you through the breathing exercises. They help you what position you would, it's like somebody who is there. So if you don't have a doula, a spouse could do it for you, or your relative could do it for you.
Absolutely.
So, but there are sometimes some families, this is a single mother, she doesn't have anybody, so she can hire a professional service, which is available. So it's that kind of support. And of course, the health provider will be there.
Absolutely. With their medical staff.
Yes. Right. But this is an additional thing which is available now. Like, so there are women who are trained, who have all the knowledge of the birthing process, and will give you support in that form.
पुराने ज़माने में दाई जिसको बोलते हो, right?
पुराने ज़माने तो दाई डॉक्टर भी होती थी.
हाँ, exactly.
तभी डॉक्टर नहीं होते थे तो but जो medicalization हो गया है of childbirth is also because of the changes that we are having in the society. We are leading more sedentary lives. Okay, we are having fewer pregnancies, and then we don't want to take any risk. In the days of dyes, we used to also have a high neonatal mortality. That time the women used to have so many pregnancies and, not all children used to survive. Those circumstances are not there anymore.
Absolutely.
So that is why, and of course, we've made such huge advancements in science, which all of us have to take advantage of that. Right? I mean, it's no point. I mean, there is a particular level to how much you can be natural.
Yeah.
Beyond that, you don't want to endanger either the woman or the child.
Yeah.
So you have to use the modern medicine tools to help you. But that doesn't mean you need to leave all the other things. You have to use that as well.
Sanskar, which is the right combination of your ancient with the modern, with the right balance of it. Like actually, absolutely, like the holistic way, what we call it.
Correct.
True.
Yes.
Right. So, doctor, from your personal experience of your career or any stories you have which can emphasize the importance of planning, how important it is.
So I think when you are prepared in all this manner, many times you would know what to expect. So we've had women who've worked throughout the day. I've had a lady who went to the office, came in labor, and she had it's the first time and delivered in 2 hours time.
Wow.
So basically, it depends on how relaxed that woman is. So now it's again another human being. Now she didn't feel the contractions that much. So it also depends on your physical, personal, self.
Yeah.
So that is one end of the spectrum. The other is somebody who's extremely motivated, to have a normal delivery, has done everything, herself, physiotherapist and all that and everything. And then because of some unpredictable thing, you end up with having a cesarean section. Either for a fetal distress or, the labor not progressing as per, the kind of speeds that I told you that we generally, follow for evidence-based medicine. So you have all the types in that.
Despite your best preparation nature.
Yeah, so you don't have to kind of, think that it doesn't work. It didn't work for me. It's not like, you have to be a little flexible, especially in terms of when it comes to labor. Yeah. So what is important is the outcome, both for the mother and for the baby.
True.
So I think that is important. So I mean, all obstetricians like us will have plenties of stories and of all different kinds. So you have to understand that you are unique.
Yeah.
So whatever experience you have, just enjoy. Absolutely. And don't be very rigid about, this happened, if that happened. Just go with the flow. That is the best thing.
Like, since we've done so many of these podcasts, holistically putting, वो बोलते हैं ना, जब आपका attitude flexible होता है, which is what every human being should have.
Correct.
जब आप flexible हैं and you're taking every moment as it is coming.
Yeah.
See, it's a double-edged thing, right? Because you're like that, you may end up having a smooth delivery. But at the same time, God forbid कोई complication है, क्योंकि आप flexible हैं, instant acceptance, and you have a smooth cesarean or whatever that thing is.
So it's just about
it's an attitude,
building resilience. That whatever situation comes in front of me, I'm going to be able to face it and accept it, and that's. I think overall we have to use that for our life. It's like a life mantra.
Like I said, you are the lifestyle specialist. Like I put it like that. I wouldn't call it life science. Life science specialist. Yeah. So that's perfect. So Dr. Vance, now that you have enlightened them about the D-Day, the baby delivered beautifully, comes the most important part, the postpartum support.
Yeah.
Right? And we've spoken about it. We've had a podcast on it. But I think this is one area right after delivery, the emotional and physical support, and in the days to follow.
Yeah.
How would you define that?
Yeah. So it also comes in the preparedness for labor. Of course, the postpartum also has to be looked at.
Yeah.
And it is also taught in the childbirth classes where, you're kind of familiarized with the process of breastfeeding. And it's a phase of hormone changes. Like, after the woman delivers, there's a lot of going on in terms of hormones, and that can affect the mental health of the woman. Okay, one is, of course, that plus the sudden added responsibility of the child can sometimes be overwhelming for certain women, and they can go into postpartum depression. So if you have some knowledge about it, that this is possible, so it's important to know what is postpartum depression. No, it's like when you don't feel like being with the child, you feel like crying, you have a lot of mood swings. I just not feeling. So it's very important to communicate and take help at the right time. Okay. So that is one aspect of postpartum that you have to understand. Second thing is very important for the child is the breastfeeding. So breastfeeding is actually it's the tailor-made milk for your child, right? So that is always going to be the first choice. So you have to understand what are the different ways of breastfeeding, the positions, the proper technique, all these things. If you are knowledgeable about, it will be very useful during the postpartum period. So that is another information that you need to acquire for the postpartum period.
Very important part of the birth plan.
Absolutely, right. Because the breast milk is like amrit for the child. It has all the immune factors. It is exactly made for that baby. So if we have to always give that first, and for some reasons, if that's not available, then we turn towards alternatives. True. But I think that is it's very important to put that message across that it's good for the baby, and it's also good for the mother, because it is going to help her uterus come back to the original shape. Also help to keep get her shape back to the, you will burn some fat when you're breastfeeding.
Right.
So all that things are good for the mother as well. The emotional bonding is there because, when you're taking the baby close to you, you have formed that bond already. Right. So it's very important to know about these two things in the postpartum.
And comes the most important part, the partner's role in this time. Especially, of course, the family and the supportive people around.
Yeah.
But the biggest support, the partner.
Yeah. So the partner also is good if he has a good understanding about the entire process as much as the woman has, because he is going to be the pillar, during the process of birthing also. So the way he can help is see that the woman is, all her needs are taken care of in terms of, whatever she wants to eat, drink. Okay, help her, guide her with the process of the breathing exercises. There are certain massages that the partner can participate in, which releases endorphins into the body and helps to alleviate the pain. Many partners would like to be there present at the time of delivery, and have the child come when both are present. So all these preferences become part of the birth plan, where you could, sometimes the hospitals also allow the partner to be there during the cesarean section.
True.
So all these things can be prepared, and I think finally it's a family. Both spouses are, going to take care of the child together.
True.
As a unit. So even if he is not himself going through those processes, his support can be very, very crucial and vital for the woman.
Absolutely. Actually, it's easy to say that you're not going through the process, but in any circumstances, जब आपका एक जना लाइन के उस तरफ होता है, जो इस तरफ होता है, उसके palpitations, उसकी anxiety. I think that is also like they do go through their things. So
they go
very
through.
fair to them. They
They
also go through a lot.
Absolutely. And the excitement and everything is equal.
Bilkul.
Surely.
Equal. Yes.
Yeah.
So very important. Partners, supporting families, friends, and everybody around a pregnant lady. Please help and support, because postpartum can be very dangerous. Let's put it like that, right?
Yeah.
But
And especially if you have any kind of, sometimes it can go to the extent of suicidal thoughts.
Exactly.
And we have had certain instances where, if it's not dealt with at the right time, then it can be disastrous.
Absolutely.
So
Like now, at least we know it's a medical situation,
yeah,
and it is not like a woman is throwing a tantrum.
absolutely.
Please
It has to be diagnosed, and you
Yes.
can use
Yeah.
psychotherapy or medications, and it's all very individualized treatment,
And it's very temporary. It can be really taken care of.
yeah.
Give them the support. Absolutely. Absolutely. Yeah. So, what would be your top 3 tips from your uh, practice of your career, which you would want to give them for the expectant parents?
Yeah. So first is get all the information, empower yourself with all the knowledge.
Yeah.
Okay. And then, as I already said, apply that knowledge to your own situation. So have a birth plan where your health provider is your collaborator. He or she will, discuss what all will be your preferences,
Right.
and build a great support system. These 3 things are the most important in terms of preparedness for labor. If you have these things in place, then you can expect that, you won't have to worry about.
Yeah, because it gives you that confidence also, doctor, that
Yeah.
आपके पास support है, आपके पास knowledge है, आपके पास wisdom है, आपके पास facilities and tools हैं, और क्या चाहिए? Absolutely like that.
Yeah.
What would be your final word of advice for the audience?
Yeah. So I think understand what the process is, okay, and go into it with a very positive feeling. Okay, don't try to get rid of all the fears, and little fear and stress is all right.
Yeah.
I mean, you do feel that something is fine. There's nothing wrong with it, and go with your intuition as well.
True.
That is what we doctors learn from patients, that sometimes the patient says something, she knows much better than sometimes even the doctor. So don't ever neglect your own intuition. If you have any kind of feeling during that process, you communicate it to your doctor.
The inner voice. Listen
The
to
inner
the
voice. Inner voice. That is another thing which I think all women should, they should have that self-confidence, and that leave the self-doubt in your own bodies and your minds. So be rational in terms of elevating all those irrational fears, and that only will happen when you empower yourself with the correct information.
Absolutely.
Okay, because there's so many myths and things which are around labor, which are built over. So if you are able to do that, and you listen to yourself and have built a great support system, you have to have, because it's a journey where you're embarking with a new life. You have a partner, spouse, or maybe even on your own. But you need another human being who will be there to support you through this. And then the journey will be very beautiful.
Absolutely. Yeah, absolutely. So I think what I would like to sum up this whole thing is that if you have a holistic approach, and like they say, जैसे एक बिल्डिंग बनाते हैं तो उसकी जो फाउंडेशन की पहली ईंट है वो बहुत बहुत इम्पोर्टेंट है. I feel this preparation starts much in advance in terms of your nutrition, your exercise, your yoga, your mindset, emotional, physical fitness, mental health. Like जो हमारे pillars हैं गर्भ संस्कार के, let's put it in a simple way. अगर ये preparation सही है तो बिल्डिंग तो स्ट्रॉन्ग बनेगी ही बनेगी.
बिल्कुल बनेगी. और लेबर में आप whatever tools you've used in your antenatal period, you are going to use the same tools.
Absolutely.
Because whatever you have used to relax you during the pregnancy, the same thing is going to come to your rescue even when you're going through the process of labor.
Absolutely.
So all those things can be used.
So like every time I realize that जिस preparation को हम तो focus करते हैं खाली pregnancy के लिए, actually as human beings we all need that preparation, right? And when we have that kind of preparation, which is never too late, right, to starting from the beginning, if we are blessed, I mean obviously हमारी ये journey भी smooth हो गई, and God forbid अगर हमारी personal journey उतनी smooth नहीं है तो at least हम अपने बच्चों को वैसे train कर सकते हैं.
And pregnancy and this entire process is a time when the woman is most motivated to change.
Absolutely.
Because it's about selfless love. You're doing it for your baby.
Absolutely.
So if you have the right information and the right tools to do it, then there is a good chance that you will adopt these things which are good for you during pregnancy are absolutely going to be better for your entire life.
Absolutely.
So that is not only benefiting your child, but it's going to also benefit you in your life in future. So I think it's something which you have to understand all these holistic things. It's a great opportunity to do it at this time in your life.
Absolutely. They say these are new beginnings. And when you say new beginnings in terms of you becoming from 2 to 3, starting a family, actually, even as a human being, it can be a new beginning,
It is.
Yeah,
It is actually you are creating the new next generation.
Absolutely.
You're reliving yourself through your child.
Absolutely. So thank you very much for being here again. And we hope कि आपको ये podcast हमारा बहुत 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 beneficial लगा होगा. If you still have any questions, any doubts, we are always there. Please feel free. जरूर पूछिए आपके सवाल, आपके doubts. Have a very smooth, healthy, joyful delivery. Welcoming your divine child, and we bless you with the best. Thank you so much for being here with us. God bless. Thank you so much, Doctor.
Thank you.
For all this beautiful knowledge. Honestly, I wish हमारे time पे भी ये सारी इतनी knowledge होती. But like they say, blessed है ये नई generation जिनको इतना कुछ मिल रहा है सामने से, right?
True.
So thank you so much for being here. Thank you, Doctor.
My pleasure. Thank you.